Thank you for that kind introduction. I think before I start, I will ask, if we woke up tomorrow and there were no patients, who would have a job to go to? No one. So patients are important to all of us, including myself. I need patients to survive, but the patients must be happy. Okay, so it's a joy and an honor to be here tonight among brilliant minds, innovators, and partners who are shaping the future of healthcare in Africa. So this theme, today's theme, fostering partnerships for strong and resilient pharmaceutical systems in Kenya and beyond, couldn't be timelier. So I stand here today wearing 4 hats: 1 as a pharmaceutical professional, 2 as a patient, now survivor, 3 a cancer advocate, and 4 the board secretary of KENCO, which has been said. So KENCO, Kenya Network for Cancer Organizations, is the national umbrella body that comprises of over 70 registered civil society organizations across the country, which are all actively engaged in various aspects of cancer control. We support people walking through one of the most difficult and life's hardest journey. So each of these roles has given me a different window into the pharmaceutical system. All the way from manufacturing, a lot in between, sales, distribution, regulatory, dispensing, from the boardroom to the bedside as a patient. And I've learned one thing, and this is that behind every pill, behind every policy, and every protocol, there is a heartbeat. Whose heartbeat? It's the patient's heartbeat. And that's what I'd like us to think about tonight. So 5 years ago, I was diagnosed with breast cancer, and my world shifted. And overnight, everything changed, and I saw a new reality. A lot of medical terms, familiar to me, thankfully, because I have a pharmaceutical background, but then I put myself in the shoes of the common person. It was a whole lot of jargon and confusion and big words. Then there was endless tests, treatment, procedures, infusions, injections, whatnot, that tested my strength in every way possible. So suddenly, the pharmaceutical system was not something my 5 years of training prepared me for. Neither was it something that my over 10 years of work in the pharmaceutical industry prepared me for. My job involved sitting with doctors and discussing other patients, talking about what the drugs I was promoting would do for them, do to them, improve the quality of their lives. This time I was the patient. It was no longer about what I had read in textbooks, no longer about what I'd been trained to do. It was about me. So every drug, every appointment, every procedure, every delay, everything now carried a new meaning to me. It wasn't business as usual. Well, I was fortunate to access good treatment, and for that I'm truly grateful. But I also encountered challenges that so many patients face, because I interacted with a lot of patients when now I started speaking out and got to meet different patients. The high cost of medication, the long waits, lack of drugs, broken equipment, and just the feeling that decisions about my care were being made around me and not with me. So one day I remember sitting in the waiting for one of my appointments, looking around. All patients look lost because they don't know what's going on. And one struck me. There was a lady who was sitting beside me, and she had a report that she pulled out of an envelope. And no see me, we say macho hayana pazia. I sort of looked at what she was reading, and she had a biopsy report, and it was a positive report for cancer. And I was wondering what was going through her mind, because I can imagine this is someone who is reading such an impactful, a big, life-changing report about themselves. And in my head, I thought, why is she reading this by herself? She should be discovering this with the doctor, which was what I always did. I know there are many patients who go pick their lab tests before seeing the doctor. But in my case, I would wait to discover everything from the first day I stepped into the doctor's clinic with a lump in my breast. I always discovered everything with them. So I just kept on wondering, you know, this is not something you want to discover by yourself. If you're being told you have cancer, you want somebody next to you holding your hand and something like that. It reminded me that healthcare is not only about treating diseases, it's about treating people. So really, I wish I spoke to that lady. At that point, I did not know what to tell her. So I just sat and all these thoughts ran through my mind. So now we ask ourselves, why do patient-centered approaches matter? When we talk about a patient-centered pharmaceutical system, we are talking about more than empathy. We are talking about effectiveness. These things have to work. And when patients are part of the conversation, then they understand their treatment, trust the system, and feel seen, and outcomes improve. I would like to read a message from a survivor she's actually a patient now. She's dealing with a recurrence. And I asked in one of the support groups on WhatsApp that I'm in, has any one of you ever interacted with a pharmacist during the course of your treatment? Because I never saw a pharmacist come to see me when I was going through chemo, all 8 cycles of them. The whole time I was in the ward, I did not see any pharmacist coming to even say hi. And as a pharmacist, I thought, this is a gap. So I only met the pharmacist when I was picking my drugs to go home, when I'm told, okay, this one, take once a day, this one, take, blah, blah, blah. And to be honest, I don't think that was enough. And fortunately, I spoke in a webinar for oncology pharmacists, and I raised it, and something seems to have changed. So I think making noise matters. So this is what a friend wrote. I actually interacted quite a lot with the pharmacist during my chemo treatment. She would come to the ward and talk to all patients. I found it interesting too, and I loved it. I would ask about possible drug reactions and even the impact each medicine had on the body. Over time, I got to learn the names of the drugs and their specific functions. Sometimes I would even request the pharmacist to write things down for me, so I didn't forget which drug does what. That interaction really helped me understand my treatment better and feel more in control. This is what we want all patients to talk about. I was fortunate that with my pharmacy background, I could read and understand all these things. I would go and read about the drugs, interactions, and whatnot, and why I was going through the side effects. But that didn't happen. And if anyone here works in a hospital, there's something that you can go back and change. So patient-centered approaches build trust. They improve adherence, like we've seen in Mary's message, and they make innovations more relevant and accessible. And ultimately, they create the kind of resilience this theme speaks about. Resilience that is rooted in connection, not just capacity. Because the patients are human beings. They need to have a connection. They need to see a face behind these drugs that they are receiving. So, patients aren't just recipients of care. We are partners in the journey to better health. Kenya has made many strides in strengthening our pharmaceutical system, from local manufacturing to regulatory reforms, but there's still work to do. Decisions about pricing or availability often happen without patient input. And KENCO have recently been in the streets talking about the cost of treatment. SHA is not covering this, that, and all of that. So the patient still remains at the center of all these things that we do. So we are looking at a Kenya where the patient is at the center, where feedback from real patients informs research, distribution, and communication strategies, where digital platforms connect patients, pharmacists, and regulators in real time. I know in this era, we can have apps and all these sorts of things that can form an interface where we communicate. And now to what tonight is truly about, partnerships. They are a bridge between science and humanity. And when pharmaceutical companies, I hope some are represented here, collaborate with patient organizations, they don't just improve medicines, they promote trust. And just to give one example very close to my heart, I discovered earlier today that there is a partnership between AstraZeneca and the Aga Khan University Hospital, where they are offering a test, a genetic test that is done on patients with triple negative breast cancer, metastatic prostate, and ovarian cancer. This test I did in 2021, and it cost me about 180,000 out of pocket because no insurance was paying, and my blood had to be sent to India. Now this test is being done in Kenya, and it costs about between 40 and 50K, and this partnership is not subsidized. The patients will pay only 6,500 for this test to establish their genetic status for these 3 cancers that I've mentioned. I mean, these are the kind of things we need to see where decisions are made around the patients for their benefit. So when regulators sit down with advocates, policies become more grounded and responsive. Researchers engage patients, our studies will become more ethical and relevant. As I get to close, so we want connections that ensure that what's produced with good intent reaches the patients with dignity, transparency, and compassion. We have to maintain the face of humanity in our interactions with the patient. So as we look ahead, my challenge and my hope for all of us is this: whatever decisions we make, in the lab, in policy, in production, when we are dispensing, the steps that David put up here, we should pause and ask, how does this decision impact the patient's experience? Because a strong pharmaceutical system isn't one that delivers medicines efficiently, it is one that restores dignity, builds hope, and earns trust. So let's create a future where patient-centeredness isn't an afterthought, because actually that is what it is at the moment. But it should be a guiding principle where patients are not just statistics or case studies, but they are valued partners in innovation and change. So as someone who sat on both sides, both the patient's chair and the advocate's desk, I can tell you this: the difference between despair and hope often lies in how we are treated, how we are heard, and whether how we feel, or whether we feel that we matter. So tonight, let's celebrate progress and partnerships. Let's renew our commitment to listen more, to collaborate more, and to build a system that sees the patient not as the end point, but the heart of it all. Because the measure of a strong pharmaceutical system is not only in the medicine it makes, but in the lives it transforms. And with that, I will leave you with this: let each one of us in this room play our part in transforming lives. Thank you.